I am a qualified counsellor and I work in private practice and I currently work online. But in the past, I've worked for the NHS in England as a counsellor in the IAPT program. And I've also worked for a local low cost agency. So I've seen many, many clients over the years who have presented with different emotional issues in terms of the actual nature of the problem they're experiencing and the severity of the issue. But I've also worked with clients who have come to therapy at different stages of readiness to talk and to explore their issues. I have seen clients who have been very open, very willing to talk about what has been concerning them, and they have been very open to any questions that I ask them or any areas that I really push and challenge them on. However, I've had other clients who have not engaged at that same level purely because they have been earlier in their journey towards readiness. So they haven't been as ready or willing to talk about certain aspects of their life because it's still raw, it's still painful. And that's why they come into counseling to get over that and also understand how they can better manage that. So one of the things I want to explore in this video is the question of, am I ready for therapy? Like, how do you know if you're ready for therapy? There is no downside to therapy. Now, you might be thinking, of course, I'm going to say that because I'm a therapist. But let me tell you, as someone who has undergone therapy myself, I know that it's helped me to increase my self awareness, to better understand myself, and not only how I react to things, but also what environments and what things I deserve. So, understanding better how to put in place boundaries, understanding and refining what my goals are, understanding what my true value set is, and what my unique contribution is. So, therapy has allowed me that opportunity to explore these things, and now I'm taking those things forward and applying it in my own life. You don't need to have goals in order to see a therapist. You may well have goals. You may well be like, look, I'm going to see a therapist. I'm paying. Therapy can be quite expensive. And so I want to make sure I go out of there with specific goals. So, of course, you can work with your therapist and tell them what you want to get out of counseling. So, that's usually one of the questions a counselor will ask, usually at the beginning, is what do you want to get out of our sessions together? And it might be that, I want to improve my relationships, or I want to learn how to say no, or I just don't want to react from an angry place anymore. Or it could be just learning to be more comfortable with yourself. So it could be any goal that you want to achieve. And knowing what goals you want will also help you to find which counselor, but also which counseling modality suits you. If you do not have any goals in therapy, that's also fine. You don't need to have a goal. You might just want therapy to have a space for yourself, a 50-minute or hour slot every week just for you. Just maybe you want silence. Maybe you don't want the therapist to say anything. It might be that you have no goals, but you just want to discuss ideas you have or discuss feelings you have and make sense of them. And you want someone to help you make sense of them. So again, counseling, there's no downsides to it. Am I willing to explore the areas of my life that I'm struggling with? This is an important question because in order for therapy to be effective, you have to be willing to discuss the areas of your life that are causing you the most difficulty. Of course, as you're talking about very difficult, challenging situations, you are experiencing the heat of the emotions and the real power of the emotions in the session. It's not pleasant. Often we want to run away from these things. We want to escape. We don't want to think about it, let alone talk about it. But that's why talking about these things can really be difficult, and therapy can feel worse because you're constantly talking about it. But the point is, by being willing to discuss it and explore it with your therapist, it helps the therapist to get a deeper understanding of the nature of the problem and how it's impacting you. And then with that empathy and with that compassion, they will guide you towards finding a solution. So I discussed this in a previous video around the kind of 5 facts of therapy. And one of them is you may feel worse before you feel better. Um, so, is there ever a good time to go to therapy? I guess with anything, probably not. There's never the best time. However, when you go and you bring that willingness and the determination to really explore in depth the areas of your life you want to, then you will get the most out of therapy. There will be things that you may not be ready to discuss. And I've certainly had experience with clients who have said they are not ready to discuss a certain aspect of their life, or they don't want to go there, or it's been so traumatic they don't even remember what happened. And it's important that the counselor respects that wish. No therapist or counselor should ever push you to talk about something you're not ready to talk about, because in some cases it's potentially dangerous. The reason it's dangerous is because you may have had something happen to you that's been so traumatic, it can cause you to disassociate or trigger some symptoms of things like PTSD in the moment, and that is potentially dangerous. So a therapist should always be guided by what you want to discuss. Now, there might be an aspect of your life that you know is relevant to the session, but if you feel you're just not ready to talk about it, you don't feel safe talking about it, you discuss that with your therapist, and they should respect your wishes. The second question you should ask yourself is, do I want to change, or do I want things to stay the same? I think the reason most people come to counseling, probably everyone goes to counseling and therapy, is because they want a change of some kind. Now, whether they're ready for the change or not may not be immediately obvious. So you might want to go to therapy and be like, I want this relationship to end and I'm ready for it to end. I've had enough. I'm fed up. I just can't seem to leave the person. It's a very toxic relationship. So again, a therapist can help you and guide you through that. It might be that I want this relationship to end, but a part of you is not willing to let go. Maybe that's why the relationship hasn't ended. So again, you might want the change, but are you prepared for the change? Do you really want it? You might want it initially, but as you start discussing things in therapy, you're going to have these conflicting things come up. I want it, but at the same time, I feel guilty if I leave this person. This is going to play out, but this is all normal. This is all understanding and adding to what's going on within you, the kind of cycles of thoughts and emotions, the self-awareness that you can then take away and say, I'm doing this again. This is why I'm stuck in this repeated cycle. Now, it might be that you don't want a change, or you feel that actually my life's not perfect, but I'm kind of really afraid at the concept of change, or anything like that. You might feel like you don't want things to change. You just want things to kind of be a bit better, but you don't want any big life dramatic shift. And therapy is not really about that. There aren't these big shifts in the way that we relate to others. It's not like you go to one session and all of a sudden you're a different person. Not at all. So the change that happens, if you want it, is very gradual. It takes practice, and you kind of check in with yourself throughout that whole time. So there's no big surprises. Another question to ask is, do I believe that therapy will help me in some way? That you might have goals you want to achieve, you might want a change in your life, but maybe you feel therapy doesn't work. Therapy, talking about your problems is no good. It just makes things worse. Why talk about it? I just want to do stuff. But if you find that, and ultimately it does come down to doing stuff, taking action, but in order to be ready to take action, there has to be a degree of self-awareness and willingness to do that. And if you find yourself unable to take action, it shows there's something stuck in the cycle. There's something getting in the way. And therapy can be a very useful place to explore that. It's better to be honest if you feel that therapy is not going to work. So you may well be having therapy right now. Maybe a friend of yours or a relative has kind of asked you or forced you to go to therapy against your will. You don't want to, and you kind of believe it just doesn't work, and you're not engaging. It's worth being honest with that with your counselor or therapist, or it's worth being honest with that with yourself, that I don't think therapy is going to work. Because if you have that mindset going in, it will throw up obstacles. Because what's going to happen is you're going to start therapy believing it's not going to work, doubting everything the therapist is saying. Now, the therapist is playing a role, depending on the skill level of the therapist, they're going to be playing a role of convincing you why therapy does work and trying to convince you. But when they start playing that role of trying to convince you, that's going to further amplify your thought that, oh, look at this person trying to convince me. I knew it doesn't work. He's trying to over justify now. Whereas a skilled therapist would catch that and say, I noticed that you're not really engaging with me. I wonder what that's about, and just have a non-judgmental, honest conversation. Because sometimes if we think therapy is not going to work, we're going to be very dubious about the therapists themselves. And so that's going to interfere with the work. So be honest and be open and have that conversation with them. The final question I would encourage you to ask yourself is, if I feel nervous about the idea of going to therapy, does that mean it's better not to? This is a really overlooked question because as you work with a therapist, things may come up that you weren't anticipating. So you might start talking about the problem that you had originally intended to come to counseling for. But as you start opening up and discussing it, other areas of your life emerge and they come into the picture. You didn't plan to discuss those things, yet here they are. You're talking about them. All of a sudden, am I getting in over my head? Am I discussing too much? Am I sharing too much? Things may come up that uncover a lot of pain from the past. However, a good therapist will be able to work with you within the limits of their competency. And so instead of going into an area that they're not familiar with and that they're not skilled to maintain and manage and discuss with you and work with you, they should be able to help you heal from those things that you're discussing. They should be able to help you to manage how you feel and help you to heal emotionally from those past experiences that you're bringing in. The last question I'd like you to ask yourself is, if I feel nervous about the idea of going to therapy, does that mean it is better not to? Now, this is an important and overlooked question. So if you find yourself asking yourself, I'm feeling nervous about going to therapy, I don't think it's worth doing, I would like to encourage you to stop and ask yourself that question again. If you're feeling nervous or anxious or scared or frightful, or you have a lot of anticipation about what's going to happen, that's completely normal. This is coming from a counselor and a client myself. This is completely normal. It's normal to be unsure about what's going to happen in a session. It's normal to be unsure about how you're going to change. It's normal to be unsure about how others are going to view you and all of this, but that doesn't mean you shouldn't do it. In fact, I think if you're feeling anxious or nervous about it, that's a sign you should go ahead and do it because it will help you in the longer run. Now, when you're working with a good, skilled therapist, they should recognize this. They should check in with you to say, I see you seem a bit apprehensive, just want to check how you're feeling. And they will check in and support you being present in the room. They will encourage you to talk and be present in the room. And the fact that you're present is a sign that you're willing and that you're motivated in therapy. Now, it may be as part of this, you feel nervous because you want to come to therapy to discuss one issue, but you're afraid that you might be talking about other areas of your life that you may not want to discuss, you may not want the therapist to know about. And it is very possible because as you speak about your issues and things you want to work on, there may be other things in your life that crop in sessions in the future. But that's okay. Don't think about that too much. If you just start with focusing on what you want to get out of therapy, as you develop that relationship with the counselor or the therapist, you will feel confident. You will feel more confident and comfortable with them and assured with them. You can then decide if you want to bring those things in. And even if you discuss those things unwillingly or unknowingly, it comes in and you're like, oh, why did I say that? I can't believe that. Because that has happened with clients I've seen before. That's where the therapist will check in and assure you that it's okay, that they've heard you, they understand how you're feeling, and they'll work with you to make you feel better in that session in real time. To summarize this video, I would encourage you to ask yourself those 4 questions. Am I willing to explore the areas of my life that I'm struggling with? Do I want to change, or do I want things to stay the same? Do I believe that therapy will help me in some way, or do I think it won't make any difference? If I feel nervous about the idea of going to therapy, does that mean it's better not to? So if you ask yourself these questions, try to answer them for yourself to see if there's any resistance about the idea of going to therapy, if there's any resistance about the fact that therapy might help. Be honest with yourself and see if you can challenge yourself to tell this to your counselor or to contact a counselor and share your concerns with them. Often counselors will invite you in for an initial consultation. So it's essentially a chat for, for however long, 20 minutes, maybe 30 minutes, just to get to know you a bit, find out what you want to get out from counseling and answer any questions you have. So most counselors do tend to offer that. That might be a good opportunity to bring these issues up. And then at least then you get a sense of what that counselor's like. Did they answer your questions well? Did they put your concerns to rest? Do you feel a bit better after that? And then you can then decide whether you want to go ahead for therapy or not. But in my experience, when you're talking to a counselor who presents genuineness, compassion, and empathy towards you, there is no downside to having someone like that in your life. If you have any other questions or concerns about counseling or psychotherapy that has not been covered in this video, please leave a comment down below and I will get back to you, or I'm happy to make another video about this, because there is a lot of trepidation and resistance at first when undertaking counseling for the first time. There's a lot of stigma that's been attached to it previously, but really the experience is nothing like you would expect, and it's certainly nothing like I expected. I appreciate you watching, and I'll see you in the next video.